Welcome, viewers. And today we are going to discuss about MRI changes in acute ischemic stroke. Though we don't need to do MRI in all acute stroke cases, CT scan is sufficient for us to rule out bleed and thrombolize, patients with acute ischemic stroke. But always MRI gives us more information in cases of acute ischemic stroke. And so routinely MRI also gets done either at the first or after CT scan. Now, what are the hallmarks of acute ischemic stroke on the MRI? So, as we all know, it is the hyperintensity on diffusion weighted images and hypointensity on ADC maps. So, these are the hallmarks of MRI findings in acute ischemic stroke and how long these changes last. So, usually these changes last for say 7 to 14 days, not beyond that. But so is that all, but in a study it was found that at the end of 1 month also hyperintensity on diffusion persisted in about 64% of cases. So about two-thirds of cases can still have some hyperintensity on diffusion weighted images 1 month after the initial diagnosis of acute ischemic stroke. And if you look at the record, it has been about 8 months. So one reported case where the hyperintensity on diffusion weighted images and hypointensity on ADC maps persisted for about 8 months, and that is the longest persistent acute infarct changes seen and then reported in the literature. The next point is, can MRI be negative in acute ischemic stroke? Answer is yes. If you look at large series, about 6.8% of acute ischemic stroke MRI brain is normal. That means diffusion as well as ADC maps are normal. And how do we know that? Because when the serial MRIs are done later on, then MRI changes do appear. And if we compare the posterior circulation infarcts versus the anterior circulation infarcts, the posterior circulation infarcts are 5 times more likely to be MRI negative in the initial period as compared to anterior circulation strokes. And when the imaging is repeated after 127 hours, that is almost about 6 days after the initial diagnosis, then MRI changes do appear. Then another term is called as reverse discrepancy. And what it means is that after the acute stroke, ischemic stroke, CT scan shows the abnormalities, whereas MRI is negative. Normally, we would expect that MRI would show and changes and CT scan will be negative. But in some situations, it is the reverse, and that is called a reverse discrepancy. And this occurs in about 13% of cases. Typically, it is seen in basal ganglia infarcts where hypodensity is commonly seen on the CT scan, but the MRI is negative. But if you do serial MRIs later on, they do show infarcts later on. But in the initial period, CT shows the changes. And if you look at posterior circulation strokes, the infarcts in medulla again, it can be negative in the initial period, but later on, say after MRI is repeated after 4 to 5 days, the MRI changes may appear. So these are some of the important things to note about the MRI findings in acute ischemic stroke. And one last point I would like to say that the concept of diffusion perfusion mismatch, and this is useful when we are in doubt whether to thrombolize the patient or not. If the patient is in window period, that is 4.5 hours after the initial onset of symptoms, then there is no doubt we have to thrombolize the patient. But if patient comes beyond 4.5 hours after the onset of symptoms, or if it is a wake up stroke, so where we don't know what time during the sleep patient had the initial onset of symptoms, in such cases we can go for diffusion and perfusion MRI studies. Diffusion changes shows the core infarct, so the amount of infarcted tissue that is damaged and that cannot be repaired or cannot be salvaged, whereas the perfusion MRI shows the penumbra, ischemic penumbra around the infarct core, and the additional extra area of the brain which is involved on the perfusion, that is the area of brain that can be salvaged by doing intravenous thrombolysis or mechanical thrombectomy. So when in doubt whether to thrombolize or not, in those situations, diffusion perfusion MRI can be very useful. So I hope this was useful for you. I'd be happy to listen to your feedback or any comments or queries. Thank you. Have a good day.